Penn State Hershey IBD Center was founded in 2013 and basically has been in existence therefore for about 4 years. It was founded with the concept that patients would be the center of our care paradigm. That included things like having a dedicated phone number for patients to call, be directly connected with a nurse navigator who would chaperone the patient through the care process. It included being seen by both a gastroenterologist and a surgeon at the same time if necessary. It included having outreach symposia for patients in regards to educating them and helping them become part of the care team so that they could also take part in decision-making regarding their own care.
What makes our center unique is we provide a multidisciplinary set of services within one setting. These include colorectal services, gastroenterology services, nutritional services, and psychological support. So people who access our services are able to use all of these in one setting, in one place. We also have an extensive group of support staff, including a nurse navigator, community support groups, which patients can access.
We are very fortunate to have a physician assistant who her background is as a registered dietitian, so we're able to use her expertise with our patients, which is a big asset. We also have psychological services in our clinic, where we have a psychiatrist in clinic once a week to meet the needs of our patients, just related to dealing with stress and anxiety and making sure they're getting what they need in that regard as well. So we really do try and provide every service that we possibly can to meet the needs of the IBD patient. Their care is not simple. It's very complex, and it's a lifelong illness.
My role in the IBD Center is really to run and oversee the IBD Biobank research effort here in the laboratory along with my colleague Dr. Walter Colton. And the power of what we have and the unique resource of the Biobank are the patient samples that we have procured over the last 25 years. We have approximately 3,000 patients that are recruited into the Biobank, and one of the first things we take from these patients are blood samples. With the blood samples, we isolate DNA, and from the DNA, we can ask about certain single nucleotide polymorphisms or genetic variants that are associated with a predisposition for disease.
We have a very strong pediatric group. What we do is we have a clinic by the pediatric gastroenterologist where they summarize all the care up till that date, since the time of diagnosis. And then we have a conference where we talk about the patients, because now patients can read all their notes, and there's sometimes things that are not necessarily written in there, so we get a better, fuller picture of the patient. And I see the patient the first time in the pediatric clinic location. So it makes it a lot easier for patients. They don't have to think about going to a new location. And at that time, we kind of make a decision, a triage as to whether they should follow us with us, how quickly they should follow, or whether they can follow with someone locally, and we try and establish what kind of care they need if they're going to go away to college.
Here at Penn State Hershey, we're part of an Improve Care Now registry. Improve Care Now is a national quality improvement network that focuses on enhancing the level of care in pediatric inflammatory bowel disease. And we joined Improve Care Now back in 2014, and it really has improved the way we take care of pediatric IBD patients. We're one of 90 pediatric IBD centers in the country that is part of Improve Care Now, and together we collaborate with these centers to find ways that we can enhance the level of care for pediatric IBD patients around the country as well as here at Penn State Hershey.
I'm very proud to be part of the IBD Center at Penn State Hershey simply because of the extent of services we are able to offer patients who access our services. In addition, we are actively involved in the community in conjunction with the CCFA, and we are able to participate in community events to promote awareness about IBD.
What I like is I see anybody from 18 to 99 or longer. And I think they all are very courageous patients who have a disease that we can't cure yet. It's a chronic disease, and we have to do our best to keep it in check. And that's often teamwork between the patient and us, but also teamwork between us and all the different care providers that are involved in IBD. So for me, it's the teamwork.
Our growth and our research efforts here at Hershey Penn State has brought us to national attention. We've taken part in many national meetings focusing on inflammatory bowel disease, as well as gastrointestinal illnesses in general. We look forward to taking part in many of these meetings into the future and look forward to working with our colleagues in defining better ways to care for patients with these difficult diseases, especially inflammatory bowel disease.